Kristen Doran. I'm the supervisor with the Northern Virginia Long-Term Care Ombudsman Program. There are many distinctions between an assisted living and a nursing facility. I will say probably the biggest difference between the two is just the level of care. So I'll start with assisted living. Assisted living is typically for those individuals who aren't considered safe to live sort of either age in place or live safely on their own in the community. So they might consider an assisted living. Maybe they need just some light assistance in their day-to-day lives. It's usually defined as a community or a building where there are 4 or more unrelated individuals that are receiving care. And again, they may require some light assistance, maybe with bathing or dressing, or maybe they just need help with medication administration. The services are a little bit different. Eligibility in order to go into an assisted living will also vary from state to state, depending on where you live. I'm located in the Commonwealth of Virginia, so there are certain eligibility requirements for individuals who are looking to be placed in an assisted living if they are also going to be requesting some financial assistance. That criteria, again, is very similar to what I just mentioned, where you would just need some light assistance with your activities of daily living, whether that be bathing, dressing, medication administration, that kind of thing. As far as payer source for assisted living, there's several different ways that people pay for assisted living. Obviously, if you have resources, you can private pay to stay in an assisted living if there is a bed available. I mentioned earlier that various states have different financial assistance programs that might be state controlled, like where I live, but also some states do accept Medicaid funds to pay for assisted living as well. So that is an option for those who cannot afford to privately pay for assisted living, which, as we know, it can be very expensive. I would encourage folks that are looking to be placed in an assisted living and need that extra financial assistance to reach out again to their local area agency on aging to initiate what we call a screening. It's just a fancy word for assessment, because typically that person's going to need to meet not just the financial criteria to get financial assistance, but also a functional criteria. And as long as they meet both, then they can, and a bed is available, then they can be placed into an assisted living. Nursing facilities are a little different. So nursing facilities, typically the level of care is higher. You have an individual who needs help with probably most of their activities of daily living, bathing, dressing, toileting, maybe they're incontinent. And they usually almost always have an ongoing medical nursing need as well. Nursing facilities are usually under the direction of a physician, and care is supervised by nursing staff, including a director of nursing. They are licensed by the state and the federal government, as opposed to assisted living, which is almost always licensed at a state level and is not usually under the direction of a physician. Nursing facilities can offer a couple different types of care. Sometimes you might hear people going into what they call rehab after maybe a surgery. Maybe they've had a hip replaced or they were in an accident and they have a broken limb and they need to go into rehab to get like physical therapy or occupational therapy so they can get stronger and go home. That is typically done at a skilled nursing facility. Usually either Medicare or private insurance will pay for that kind of care. But there are individuals who live in nursing homes. This is going to be their permanent residence. They are there for what we call long-term care. And again, much like assisted living, some people can afford to private pay for that nursing care. Perhaps they have insurance that will pay for it, like long-term care insurance, or maybe they have really good health insurance that will help pay. But there is a federal program that all states provide as a payer source for those who need financial assistance. In Virginia, where I live, we refer to that as long-term care Medicaid. In order for an individual to access long-term care Medicaid dollars to pay for their stay, they need to, again, much like assisted living, need to be screened or assessed, and they need to meet a functional criteria and a financial criteria in order to qualify. And then, most importantly, there needs to be a Medicaid bed available for them in a nursing home that accepts Medicaid as payment.